The Affordable Care Act through the lens of the pluralist model. Overview of the pluralist model. Distributing power amongst multiple competing interest groups. Policy reflects compromise. Interest groups represents different social, economic, and political perspectives, results of ongoing negotiations and lobbying and advocacy. Diverse voices in society, but is not equal. The pluralist assumes that a system is competing groups that balance each other. The result of the policy negotiations rather than domination, the pluralist allows multiple perspectives to influence social outcomes and focus on the resources and the amount of access that still exists. The theoretical origins focus this slide focus on how structural functionalism views society as stable when multiple parts interact. The pluralism interest groups compete but also maintain social balance. The groups that address different needs such as healthcare and education while preventing any single group from power. The introduction of ACA, which is also known as Affordable Care Act, was signed March of 2010. The goal was to expand healthcare and access while reducing the cost and improving the quality. This required a lot of negotiations across all political parties and interest groups. Millions of people were affected. The ACA is a prime example of pluralism because it involves a complex web of stakeholders that does include political actors, healthcare providers, advocacy groups, and patients. These competing interests shapes the policy outcome throughout the signing of ACA. The interest groups that were involved were the American Medical Association, also known as AMA. They stand for Advocacy for Physician Reimbursement. Insurance companies was able to negotiate the rules of their coverage, the risk management, and the cost of sharing their mechanisms. Pharmaceutical companies are also influenced can also influence the drug prices and foreign policies and market regulations. These groups handle the financial and professional stakes in the ACA. The groups ensure that there are fundings to cover people medical needs and this demonstrates the pluralist negotiation because they are able to set their pricing based upon the insurance company plan, and this is to even out the number of needs and financial abilities during funding. Another group that was also involved is patient advocacy, state government, political parties, and minorities. These groups are very important because these groups highlight multiple professional, political, and citizen-led compete competing negotiations. These groups has less influence due to the limited resources, but it also demonstrates unequal power in the practice. So without these groups, they would the political parties would be able to do what they feel is best. But as they speak up for the people that are in need in their community, they are able to understand what is really needed. ACA policy compromises. So the Medicaid expansion became optional for state until the federal goals and the state autonomy were made a decision onto one. Individual insurance became balanced between public coverage and private marketing interests. And then pre-existing condition coverage um, became a part of the insurance company coverage from the patient advocacy success. But there are trade offs with these pre existing condition coverage, such as higher copays, higher deductibles, or having to pay or a certain amount of money as a premium before being able to get the low cost. The groups No group got everything that they wanted, but the compromises improved the access and the health outcome, but did not eliminate the inequalities. The ACA illustrates pluralisms by multiple stakeholders shape final policies, being able to negotiate the policy outcomes, the public pressure, and the political negotiations, and the shared power that was through all of the different interest groups that took a part. The balance of the pluralism is competing interests, but acknowledge some groups have more leverage than others. In the unequal power and stratification, groups are not equally influenced from the corporation and personal domination. The racial entities in the healthcare access stayed unequal. There were some improvement, but there wasn't, it has yet to get to where everything is 50-50 between everybody. There are broader social stratification with wealth and status influence, the and that influences the policy that impacts healthcare. The positives of the consequences. Policies have multiple perspectives. Millions gain healthcare coverage, reducing uninsured rates, and flexible implication for adaptation for state needs. The negative side is powerful groups can dominate debates and block reforms. The inequalities access for minorities or low income populations, and when it comes to changing or creating a new policy, is slow because of all the negotiations that happen. Social rules, status, and class. To be considered high class groups, you will be in a physician, insurance, executive, lobbyist. For a lower status group, you will be considered a patient, small organization, and marginalized communities. Policies shaped by social hierarchy and resources, and originates organization power. This reflects on the societal stratifications. The status in the class affects which groups have the most influence in shaping the policies and changing the policies after it's been done. In conclusion, ACA shows players' powers in action of multiple competing groups. Policy outcomes reflect shared influence but not power. Unequal influences persist with high status groups shaping healthcare, and ACA cases shows how pluralism works in complex social systems. It's important to know that the power dynamics of the policies is analyzed with the shared power. So whoever has the most power will have a dominancy in the negotiation. But the smaller groups speak up on what change needs to happen, the more the change happens within the ACA plan.